So what do you do before you turn 65? We're going to be talking about steps that you take before you turn 65 years old for Medicare, and you eventually just get the plan that you need for Medicare. Okay? My name is Mirabel, and I've been a licensed agent since 2018 doing life insurance and Medicare, and I really truly like Medicare. It seems to be that a lot of Medicare members, once I speak to them to put them in the plan, they don't understand what Medicare is. Okay, so I decided to create a channel to kind of explain it in an easy way that cannot stress people out. Retirement is not about getting stressed. Retirement it's about hopefully having a relaxed time. Everything is kind of, organized, hopefully. And if not, at least your health care could be. Okay? Um, there are ways to do that, and we're going to go step by step. I have some notes here on my laptop that you don't see, just because I don't want to forget anything. Okay? If you watch my last video, I mentioned that I love to talk, and I may deviate from the subject because I love to talk. I'm Cuban, I like to talk. So we're going to go ahead and go into step by step, and I'm going to be looking to my notes because I don't want to forget anything. Okay? This is a crucial time when you turn 65, so you want it, to at least go into it in a smooth way. Okay? As smooth as possible. So you join the right plan, so you have the right, you don't lose your doctors if you want to keep them, you know. Um, Sometimes the better plan for you, that doctor may not take it. So you're forced to change if you really want that plan, right? Because it offers you everything that you want in a plan. But there are great doctors in every carrier, in every network. So don't have fear about that, okay? But there are cases that maybe, you have a lot of conditions and you really don't want to change those doctors that you've had for a long time. Like I have a client that has MS, and she really does not want to change the doctors. When I met her, she really didn't want to make any changes on those doctors. Lucky enough, the same plan, which happened to be United, that she had at work, had a great plan for her. And all her doctors were there, all the medications were covered, and even the therapies, it was great. It just fit. That happens. It happens a lot. Don't be afraid, okay? So my name is Maribel, and I've been doing Medicare since 2018. I love Medicare. I love life insurance. And I decided to make these videos because, again, there's a lot of confusion out there. And I thought, let me just help out and explain things to the retirement community, right? So let's get right into it and let's talk Medicare. Now, these are the steps that I want you to take right before you turn 65, maybe 6 months before, okay? Now, you can contact the Social Security office, okay? They handle Medicare. You don't have to call Medicare directly. You can call the Social Security office, the 800 number that they have, which is a national number. If I remember correctly, it's 800 772 1312, I think. Check it out for just in case. You can also go into Medicare.gov. Make sure it's gov, G-O-V as in Victor, because that is the site. It's not .com. Medicare.gov. It's a government site. Okay? And you can also search for plans. You can create your account. I create an account for my clients. And they get a password and they have their own account. And so let's go in order. So first you contact Social Security office. Confirm your eligibility. You have to have those 40 quarters. If not, you have to have so many years and so forth. They'll let you know. That's not my part. I can tell you. Okay? Medicare will let you know if you're eligible for Medicare at that time. Because sometimes you may not have what you need, so you may have to pay for your Part A that normally people do not pay. Okay? So if you've been in this country and you worked all your life, like I have, you don't have to pay for Part A. Okay? That's why people say, no, you don't pay for Medicare. You do. You do if you don't qualify. Okay? So you go, you apply for your eligibility, you let them know, and then when you start doing your research, you are going to be going to Medicare.gov. You could do that. I do it for my clients if they don't want to do it. That's not a problem. You go to Medicare.gov, you set up your personal account, you enter your zip code, you enter your medications. It's a really easy website to follow. It's not that complicated. But again, some people are not savvy. They don't have the patience. They get overwhelmed, you know? So I do that for my clients. I set up their account, put the medications in there, put the zip code in there, put the doctors in there, and then the plans come up, right? It's just there. I can do it in my system. But if we do it in Medicare.gov on their account, they have access to that. You as a client, as a member of Medicare, you have your password. You can go into your account once it's set up, and you can change your medications and add medications if you want to. Or you can see what your agent, me in this case, I'm looking at. So you're not blindly just believing what the agent says. There are great agents out there, but there are some that are not so great. And I've seen some. Okay? So that is a great idea, okay, to have your own account. Now, Medicare is by counties and zip codes. So this is what happens when you don't know this. That means that your friend that lives in another zip code has this great plan, right? And your friend is like, hey, get this plan. This is great. My doctors are great. We happen to have the same doctor. That happens. And I have this plan, and it's awesome. Make sure you get this plan. And she tells you the details, and you fall in love with the plan. But guess what? In your zip code, that carrier doesn't offer that plan. Okay? And then you're going to say, oh my God, my friend lied to me. That's not good. Shoot, what happened? Well, it's not that they lied. It's not that it's incorrect information. It's just that in your zip code, that specific plan is not available. So that's why the agents in Medicare always will ask you for your zip code, because it goes by county and zip codes, okay? Now, this is what you're going to do. So 5 to 6 months before, that's what you're going to do. Okay? Check for eligibility. Make your Medicare account on Medicare.gov. And get all that taken care of. At least having a glance of what's available for you. Okay? Now you're going into 4 months before you turn 65. 4 months before you turn 65, you're going to need to speak to an advisor, like myself, for example, an agent, an advisor, however you want to call it. And preferably, it's going to be an advisor that has access to many carriers, an independent advisor, independent agent, not one that just works for one carrier, not an agent that just works for Humana, for example, or United, or Cigna, or Sing, or any of these plans. Why? Because they're only going to have access to that one plan. And if when you went to Medicare.gov and you set up your account and it show your plan, whatever, United, and you were happy with it, now you're going to talk to a captive agent that works for Humana. He's not going to see the United plan that you liked. And he's going to see a good plan for Humana, but it's not the one that you liked. Unless you may be happy with Humana and everything is there, or the doctors, that's fine. But you're not going to see this one. You understand? You're not going to have choices. So if you speak to an independent agent as myself, then you have access to many plans. Okay? And then you really have choices. That's the difference between an independent agent and a captive agent. Okay? Now, if you're going into an agent that says, I'll do everything for you, don't worry about it, no, that's not good. You're going to need to give authorization to that agent. You're going to have to sign something electronically. It could be sent to your email or your text if it's on the phone. Like I deal with clients or different states, that's how it's done. But Medicare requires the agent to have an authorization, given to the agent to do this application, to speak to you even. Okay? No agents can come up to you and say, hey, so and so, I have a plan for you. We're not allowed to do that. Okay? So just be aware because there's a lot of fraud out there. Okay? So you're going to have written consent. You have to click on it, I agree, and give permission to this client, to this agent to speak to me about plans. Okay? If you call, a call center that they have access to different plans. If any agent that you speak to, you have to do that. Okay? Keep that in mind. Now, 3 months before your birthday, if you are working, you're going to speak to your HR department, your benefits coordinator, okay, or administrator. Why? Well, because they have a form that you need to fill out. You have to fill out a form. It's called CMS 40B. If I'm mistaken, yeah, CMS 40B, as in boy. That form needs to be filled out so HR department, the administrator for your benefits, can send it to CMS, to Medicare. Okay, and that's how it's done. And what that form does is basically it gives you Part B. It's kind of it's like asking for Part B benefits, which is for your medical insurance. You can have Part A pretty much automatically once you call Social Security about 3 months prior to your birthday. And then your Part B, if you're leaving that group insurance from your employer, that's when you go to your administrator and say, hey, I want to get my Part B for Medicare. I need that form, CMS 40B, from you to be sent to Medicare. Okay? What is that doing? Well, what that's doing is telling Medicare that you're dropping off this insurance and you're going to go and get Part B for Medicare. Basically, that's what it's doing. Okay? Now, during your birthday month, what you're going to be doing is you have to enroll into, if you haven't, right? If you haven't enrolled yet, because you could enroll into a plan the month before your birthday. You can enroll even 3 months before your birthday. Okay? If you already do all your homework and you already know what you want, you spoke to an independent agent, you have your choices laid out, and you said, this is what I want. You could do it 3 months prior to your birthday month. 3 months. Okay? So let's say your birthday month is in March. Well, December. So February, January, December. Those are the 3 months prior. December, you can start doing the enrollment if you have a good agent that you trust and you have choices. Enrollment into the plan that's going to start March 1st. Okay? And there's no guessing here. The computer will let the agent know these are the choices for him to be effective with this plan. And the choices is going to be March. It has to be part of that choice. If it's not, then you're too early. The system will tell you. It will tell the agent, actually. Okay? So let's not worry about that. Now, remember, you have a total of 7 months. 7 months. So 3 months prior to your birthday month, the month during your birthday, you can do it. So you turn 65 in March. Anytime in March, you can do it if you hadn't done it before. Okay? It will be effective March 1st because that's your birthday month. Okay? And if you do it that month and you still have group insurance, let's say, into the end of March, because now you decided that you wanted Part B, and it's just going to be starting April 1st. You could do that. Okay? So 3 months prior, the birthday month, and 3 months after your birthday month. Again, if you went through this process and you hit your birthday month and you had not decided to get a plan yet, you could do it that month as long as you have Part B available, right? Effective. And you can start the following month. Your group insurance, if you had one, and that's why it took you a little while, is going to drop automatically the day that your new plan takes effect. It will drop automatically. Going forward, you're already a Medicare agent, everything is great. Comes, October of that year, you decide to change your plan for the following year. That plan that you have right now will drop when the new plan comes in. That's the way Medicare works. The plan that you're currently on drops off automatically when the new one comes in. Except if you have a plan G or N or F, one of those supplemental plans, true supplemental plans. And that's another video altogether. Okay? That's the way that works. So the HMO and the PPO plans and group plans drop off when the new plan takes effect. I want to make clear of that, okay? All right. Now, it's important to track, like if you do everything for your birthday month and you end up having anything that takes effect later, you have to make sure that, you still have time with your employer. So there's no rush. There's no rush. You have 7 months. You hit your birthday month and you haven't decided yet, it's okay. You have 7 months. And as long as you have coverage from your group insurance, you're not going to get penalized, okay, for not having drug coverage, okay? Take a look at my first video that I did as to my previous video as to what is Medicare, and it would explain there the need to have that drug coverage, even if you don't take medications, okay? That's really, really important. Now, let's see, what else am I missing here? Am I missing anything? Did I forget anything? No, I don't think I forgot anything. So I think we got everything covered. Like I said, I have my notes here to make sure that I got everything in orders before I talk too much. I do want to let you know that I'm starting the channel just so I can explain things to people that get confused sometimes about Medicare. So if this video brought any value to you, leave a comment, give any questions, reach out if you need a consultation at no cost. I'll be happy to assist you. And so, talking Medicare is pretty easy for me. So I just put the notes so I don't forget anything because I keep talking. But reach out, leave a comment if this video brought any value to you. I'll see you on the next one.